I'm Jim Kircher. For most of us, if and when we get Alzheimer's disease is a crapshoot. But for others, it's a coin flip, a 50-50 chance, not only that they're going to get it, but they're going to get it early in life because their families carry a genetic mutation. Well, some of these folks are now playing an important role in the efforts to find a treatment and a cure for this devastating disease. Around the world, they have signed up to help test out experimental drugs. It's part of a study that's being run by the Washington University Medical School. Once a year, Jeff Burrell flies to the Washington University Med School in St. Louis from his home in North Carolina for a series of tests and scans. Researchers want to see what's happening in his brain.
My mother and all of her brothers and my grandma passed away with early onset Alzheimer's.
And by early onset, he means his age, 46. If he misplaces his keys, it's hard to laugh it off as a senior moment.
But little things like that happen to you, and it's, it makes you stop and think, oh gosh, am I showing signs? It's scary. It's scary.
Early onset Alzheimer's is caused by an inherited genetic mutation. It's in his family, so Jeff knows he has a 50-50 chance that he's next. But it's that predictability that makes people like Jeff and his sister and two cousins ideal subjects to try out experimental treatments.
Now, this population is incredibly rare, so this is a worldwide trial run across many different countries and languages to get enough people together to demonstrate whether these drugs will have a benefit. And so it's not an easy trial.
Washington University Med School neurologist Dr. Randall Bateman is directing what's called the Diane-2 study.
We believe that this is the era in which we will begin to change the course of Alzheimer's disease with highly effective treatments.
The study is being conducted in centers around the world so that Jeff and other subjects can get their experimental drugs or placebos close to home. They're also regularly tested for symptoms like memory loss. And researchers know what causes that. Amyloid beta plaque builds up for many years until the clumps finally begin to interfere with brain functions.
In Alzheimer's disease, it's really a 30-year process. And so what you're really talking about is the last 7 years is what clinically we see as doctors, but the process started 25 years before that.
But it used to be they could only know what had happened by examining the patient's brain after death. But now advanced scanning and imaging technology shows it happening in the living, building up before the symptoms emerge.
Okay, Jeff, you're doing great. This next one is about 6 minutes.
Test subjects make annual visits to the few medical centers that have those machines for a series of scans that will be compared to last year's. The scan of Jeff's brain is going to take about an hour. Now, he's not going to know what they find or what they don't find, and frankly, he doesn't want to know.
I don't ask a whole lot of questions, actually. I used to really try to get involved in it, and now the more it goes, they're talking over my head. I turn wrenches, and not my cup of tea.
You can see the changes of amyloid deposition throughout the brain.
These are not images from Jeff's scans, but if he has Alzheimer's and the steady buildup of plaque, this is what it would look like from one yearly scan to the next. This kind of imaging, this is what you would only find in an autopsy.
Exactly.
And say, oh, look, it was Alzheimer's. Right. Now you see it happening.
In real time, in real life.
Wow.
We can see the changes of Alzheimer's occurring in these patients. Now, the drugs that we're administering are designed to target this amyloid beta protein.
And if one of those drugs is, in fact, stopping, preventing, or reversing the damage, they will see it in these scans.
Okay, Jeff, we are all finished. How are you feeling?
He doesn't know, and no one's allowed to tell him, if he actually has the genetic mutation, or if he's got Alzheimer's, or if he's getting a test drug or a placebo.
I don't know a thing. I don't know a thing. I don't know if it's helping. I don't know what kind of medicine dosages I'm getting. I don't know. Yeah, and do you want to know? Do you want to know? Do you want to know your dad?
There are multiple trials running in parallel right now. Our trial will have its first readout towards the end of 2016, 2017. And so that's when we'll have the first information about whether these drugs are hitting their targets, the biomarker measures of Alzheimer's disease in these family members, and which of these drugs may be then more likely to have a benefit in this population. Several years after that, we may have the first clinical readings of what the cognitive benefit is of a drug in preventing Alzheimer's disease. Number one reason why people do this study, interestingly enough, is not for themselves. It's not to protect themselves against Alzheimer's disease. The number one reason these families do it is because they do it for their other family members.
Like I said, if it doesn't help me, maybe it'll help our children and other people's children down the road.